Hello, my name is Dr. Saige Clark, and I am a PGY1 resident at Xavier University of Louisiana College of Pharmacy. Today, I will be presenting my research project titled Pharmacists' Willingness to Prescribe PrEP, Assessing Knowledge, Confidence, and Barriers in Louisiana. Before we start, we're going to talk about what exactly is PrEP. So pre-exposure prophylaxis, or PrEP, is the use of antiretroviral medications to prevent HIV infection in adults and adolescents. When taken consistently, PrEP reduces the risk of acquiring HIV through sexual contact by approximately 99%. The CDC recommends that PrEP be a part of comprehensive HIV prevention care, including adherence counseling, routine STI screening, proper condom use, and ongoing risk reduction education. Currently, there are 4 FDA-approved medications, and those include Truvada, Descovy, Apretude, which is an injection, and Yeztudo or lenacapavir, which is also an injection as well, which was recently put on the market. So kind of talking about a pharmacist's role in prevention. In August of 2025, Louisiana issued a statewide standing order allowing pharmacists to independently dispense and administer PrEP and PEP after completed required training. And it also in this list, it talked about reimbursement. So pharmacists may also be reimbursed at a comparable rates to other providers. Research has consistently shown that pharmacists improve medication adherence through with patient knowledge and overall outcomes. With expanded authority, pharmacists are positioned to play a critical role in increasing access to HIV preventive services. Now, mostly talking about Louisiana statistics, we're going to talk about the South in general. The South accounts for approximately half of new HIV infections in the United States. In the South, Louisiana is designated as a high priority state under the Ending the HIV Epidemic Initiative. More than 22,000 individuals are currently living with HIV in Louisiana, yet fewer than 30% of those who could benefit from PrEP are not using it. So the Healthy People 2030 made an initiative to keep pharmacists in the loop and to be able for them to help prevent HIV. With these statistics, we can see that it highlights a significant gap in prevention efforts. So common barriers are identified in previous research that are done around the country. That includes training, reimbursement, awareness, workflow, confidence, and stigma. With these barriers, this can lead to pharmacists not being able to actually treat and help prevent with HIV. So now that leads me to my research. Overview, my objective is to assess pharmacists' PrEP knowledge, confidence in counseling, barriers, and willingness to dispense. My study design is a cross-sectional online survey. I'll be using Qualtrics as a database. And then my study population would be licensed pharmacists in the 9 health regions. So for my methods, my inclusion criteria will include community pharmacists actively licensed in the state of Louisiana, as community pharmacists are more face-to-face with a lot of the patients day to day, and patients and pharmacists who are willing to provide informed consent to participate in the study. My exclusion criteria will include pharmacists who are not currently practicing in community pharmacy, so those pharmacists that are in hospital pharmacy, clinical pharmacists, and ambulatory. Also excluded would be pharmacy students or interns, pharmacy technicians, and other non-pharmacy staff. My survey content will include demographics, knowledge-based questions, confidence scales for counseling, and open-ended barrier questions. My statistical analysis, I'll be looking at descriptive statistics for knowledge, confidence, and willingness, and also look at a correlation between different variables and open-ended responses. I'll do thematic analysis. So this study is pending IRB approval, and in summary, although PrEP is highly effective, it remains underutilized in Louisiana. a state with high HIV burden. With expanded pharmacist dispensive authority, understanding readiness and barriers is essential to improving HIV prevention efforts across the state. After my ARB approval, I'll be sending the survey, and my study aims to identify opportunities to strengthen pharmacist-led PrEP delivery and expand access to care.